Hello and welcome, everybody. We are just starting to let people in, so I'm going to give it one more minute as people trickle in, and then we'll get started at about 5:01, 5:02. Hello, everybody who's joining us. I'm just letting people trickle in for the next couple of minutes as as people join the Zoom. So we're going to get started in about 1 minute. Hello, everybody. Welcome to our panel presentation tonight. I'm very, very happy to welcome you to this panel, which is entitled, I just closed it, so I can never remember the long name, but hopefully you know the title of it. My name is Talia Schiller. I use she, her pronouns, and I'm the program manager of the Academic Public Health Corps. I'm very happy that you're all here. I would love just to know who's in the room because we can't see the attendees as panelists. If you could introduce yourself in the chat, that would be amazing. I'd love to know your name, the school that you're attending, or if you're not in school, where your workplace where you work. And if you want to drop your favorite snack, I think that would be a really nice way for us all to get to know each other. Like I said, my name is Talia Schiller. I am the program manager of the Academic Public Health Corps. Before we get into the main piece of the panel today, I'd like to say a few words about the APHC. So today's panel is brought to you by the APHC. We are a program of the Massachusetts Health Officers Association, and we are an internship program. So we love to do career events like this. We do all sorts of events, and we also provide internships for students across Massachusetts in public health at both the undergraduate and graduate level. We are about to start recruiting for our fall cohort, which is why I'm telling you this information. So our internships are paid, they're short-term, they're 95% remote, and they're super great and flexible. All you need to do is be a current student in an institution of higher education, live in Massachusetts, and commit at least 10 to 15 hours per week to the APHC. Like I said, our application period is about to open. So if you're looking for an internship for this fall, if you're interested in community health or local public health, this would be a great, great opportunity for you. Our application opens on April 24th. And it will close on May 22nd. And I will put these links in the chat for you, and we'll also be sending them in a follow-up email after on Friday, actually. The follow-up email will come on Friday. So I'm just going to provide a couple of housekeeping items. We're very happy to have our three panelists and our moderator here today with us. We are going to be doing some pre-written questions for the first half of the panel. And then the second half of the panel is all going to be Q&A. So it's all going to be questions coming from you, our audience. So please come up with questions. Please write them in the Q&A box. Whatever questions you might have for anybody, anything that comes up for you thinking about career or professional development, or what it is that you need to be doing at this stage of your professional life right now, just pop those in the Q&A box. and we will get to them in the second half of the panel today. We are recording today's panel, so we will be sending out that recording on Friday as well. So without further ado, I'd like to turn it over to our moderator, Stacy King.
Great, thank you, Tali, and it's really nice. I wish I could see all you, but we're so excited that you're joining us. My name is Stacy King. I use she, her pronouns. I'm currently the Director of Field Education and Practice at the Harvard Chan School with a background in local public health. And so I'm very excited to welcome our panelists today, and I think you're all in for a real treat. So we are just going to jump right in. Panelists, I'm going to just call on you, and we won't go in the same order every time, just to kind of shake things up. But let's just start with your name, pronouns, job title, and briefly, what was your journey to your current job? So Sam, why don't you kick us off?
Hello, everyone. My name is Sam Menard. I use she, her pronouns. I am currently a senior public health inspector at the Brookline Health Department, which for those of you who aren't familiar is right outside of Boston, and it's a local health department. I started this journey to becoming an inspector, which I don't think many people, intentionally get into the field. Started at the University of Rhode Island, where I got my undergrad in animal science. I went right into the MPH program after undergrad at BU. While I was there, I interned at the Brookline Health Department for a couple semesters for the environmental health division. Decided it was something really interesting that would get me out in the field. So my last semester at BU, I started applying to inspector jobs. Luckily, I was hired in Newton right after graduation. I stayed there for a year, and then I've been working in 4 years in Brookline.
Great, thanks, Sam. Kelechi?
Sorry, I was muted. Hello, everybody. My name is Kelechi Obika. I use he, him pronouns. My current role, I work as the health services agent in the town of Hopkinton. And so I got my undergraduate degree at UMass Lowell with a concentration in health sciences. And I actually transferred to UMass Lowell. I would say, I think my junior year of my undergrad journey. So as I was, as a public health student, I was definitely interested in the local public health realm. As, graduation kind of approached, I was thinking of certain things that I could potentially do, to just get out in the fields. And being an inspector, a health inspector, was something that, kind of came to mind. But at that time, I really had no idea how to get in the field or kind of how to find a lane in local public health. So it wasn't until I had graduated in the fall of 2019, and this was just like a couple months before COVID, kind of blew up around March of 2020. So it was later on throughout that time, while I was kind of searching for jobs and stuff like that, I came up on a part-time health inspector position at the town of North Andover. And that's kind of just what rocket launched me into the field. And then from that point on, I was actually contracted on board as part of like the CARES Act package that, the state received like in response to the COVID-19 efforts. So my position there was, a contracted position. So obviously during the end of that contract, I was looking for full-time positions, and that's how I came across Hopkinton.
Great, thank you so much, Kelechi. And I'd just like to welcome Felix. Hi, Felix. We're just starting with introductions. I'll be asking Diana next, but we are just going with name, pronouns, job title, and briefly your journey into your current job. So Diana, we'll go to you next.
Hi, everyone. I'm Diana Acosta. I use she, her pronouns. I currently am the shared services program manager for the town of Needham. And I'll get into more of what shared services is a little bit later, but my journey into my current job, I was in undergrad, I studied marine science at BU. I feel like I fell into the job because I was actually working in a zebrafish lab on the BU medical campus, and the School of Public Health happened to be across the street. I knew working for the university, I was able to take advantage of tuition remission. So I was like, let me look to see what masters I can apply for. And the School of Public Health was literally across the street. So I took Intro to Environmental Health. I audited that course, and then I decided, let me enroll and do my master's in public health. During grad school, I interned in Brookline, where Sam works now, did an internship there in the environmental health program as well. And I realized that that was something that I wanted to do, coming from a lab where there was no windows. I didn't know if something happened yesterday or 3 months before, because every day was like Groundhog Day, every day at the lab. And then doing my internship with a health inspector, I was like, oh, every day is different. It's dynamic. You can have a set schedule, but things pop up all the time. It was always changing. So that's what really attracted me to the field. And I love helping people. So using my science background and wanting to help, I feel like public health was the perfect merge into that. And now I've transitioned to a role where I'm managing grants, but it's a new exciting program that the state is working on, and I'm really happy to be a part of it. But yeah, falling into it, but everything's been super interesting so far.
It's great. Thank you, Diana. And Felix, let's hear from you.
Hi, my name is Felix Garcia. I work for the town of Acton, Massachusetts as a public health inspector. I have a pretty similar summary, I guess, to Diana. Pretty much fell into it. I went to school for, I went to school for economics, but then I did a dual major in health science, and I kind of knew I wanted to work something within health. Originally, I thought maybe within like the healthcare system, but then kind of got just like thrown into like local public health. I started working my job in, well, my first job in Lawrence for my hometown, worked as administrator, then became the food inspector. I started working with the licensing department, then transitioned my way to the town of Acton, which I work a lot with land use development. So we're part of like, so within our department, we do like a lot of like soil testing. That's heavy on that here. And yeah, I like it. It's one of those things that like, I didn't know much about it. I just kind of like, you kind of work your way into it. And yeah, I appreciate local public health because, you get that interaction with people, that's my favorite part. It's like that one-on-one interaction on the field. And that's probably my favorite part about it. Just kind of like able to like talk to the people, talk to homeowners, talk to residents. Like that personal one-on-one is like my favorite part of within public health. I'm not sure if I'm sorry that I came late, so I'm not sure if I missed anything as well.
No, you didn't. That's great. And there was such a theme of, everybody liking to help people and interact with people, and just a lot of variety and kind of different pathways. I enjoyed hearing your introductions. So we'll go to our next question, which is really just about the job itself. And if you could just briefly describe your job and what does a typical work week look like for you, if such a thing exists. Kelechi, why don't we start with you this time? Mute.
Sorry about that. Yeah, so typically, on a week-to-week basis, like Diana had kind of touched upon, working in local public health, you deal with like a bunch of different things. There's so much variability, and again, dependent on the health department that you're working for, and I guess the services that they give to the community. It can vary on a day-to-day. So I mean, on a typical week, me personally, I could do anything from a food inspection to a public pool inspection, a housing inspection, reviewing a plan for maybe like a food service establishment or like a septic tank, to be installed on somebody's property. General nuisance complaints, working in as an inspector or, in the local public health realm, it kind of puts you in a position to be sort of like a generalist and kind of, take on a lot of different diverse experiences and just different kind of avenues like of community and like how local public health is concerned with it. So yeah, those are kind of just a few things, but yeah.
Great. Thanks, Kelechi. Sam, let's go to you.
Hi there. I have a similar role as Kelechi, but my primary responsibilities are conducting routine and complaint-based inspections for things like food establishments, housing, summer camps, pools, demolitions, general nuisance. You get a little bit of everything every day sometimes. It's a hard job to predict what your day in the office is going to look like. I also, just being in local public health, everyone tends to kind of serve where they're needed. So other minor roles I get involved in is I serve as the backup vaccine coordinator. I serve as one of the inspector of animals. During the early years of the pandemic, at some points, I was a full-time contact tracer. You just kind of go where you're needed, especially, if your department's understaffed or going through transition periods or things like that. So typical work week looks like a really nice mixture of being out in the field, back in the office. I even have a work from home day. That's really nice. But I think it's a very well-balanced job if you're looking to be out in the community and not just, at a desk for most of your day.
Great. Thanks, Sam. Diana, let's go to you.
So I'm managing grants now, so I'm not in the field as much anymore. So the main grant the program that I'm managing for is called the Public Health Excellence Program. So in Massachusetts, there are 351 cities and towns, and there are 351 health departments. So especially during COVID, I think the state realized, there is no like baseline in any of our departments right now. It's kind of home rule. So the idea of this program is to kind of create and, increase public health capacity, because each town, depending on their tax base, how much money is coming in, every town is funded differently. So there are certain towns that have a lot of resources and there are some towns that don't have resources. So in my coalition, our coalition is Needham, Medfield, Dover, and Sherburne. So there are things that the example I always use is Dover gets a ton of septic inspection or septic plans to review. Let's say they get 100 something a year. Needham gets maybe 6. Needham has 140 food establishments, so we're really good at our food inspections, but we only get 6 septic plans. So the idea would be to kind of share our services in that way where, hey, Dover, if you only have 6 restaurants, we can send our regional inspector out to help you so that they don't have to spend money on a third-party contractor. It could all be within the town. It's just to increase capacity, and it's been very interesting so far because I feel like the program, the phrase I always hear is we're building the plane as we go. We're moving forward in a positive way, but it's a lot of creativity involved to make sure that we're using the funds that we got effectively and in an approved way. And then I have 2 part-time environmental health staff underneath, so they're health agents. So I find myself still kind of going into the field here and there to make sure that they're getting trained on inspections and doing different tasks. So if the health department, like the staff in Needham, is overwhelmed doing what they have to do for the town and I need to teach these people, I'll step in. So like when we had permits, I use the skills that I had gained from being a health agent and still apply that and make sure that I'm passing on my skills to the next part of our team.
Great, thanks. Felix.
Yeah, kind of touching on what she said. The So like where my job now, I do a little bit of everything. I mean, definitely a lot of the work, I'm in a pretty much rural area. It's a lot of like septic, wastewater treatment. But like my last job when I was in Lawrence, everyone had like a specialty. So I was a food inspector. That was my role. You know, you have your code inspectors, they do the housing, and then you had like the building inspectors that do any construction. And but so pretty much like depending on like where you land a job in, like, you know, you may go work at a town, you do everything, or you may work for a city and you just focus on one thing. And that's definitely you know, that's definitely something to consider. I like kind of doing a little bit of everything in a way, just because you get like good base of like foundation. I like that. And so yeah, I think that's something really to consider for those on there. You know, if you are looking to take local public health, like, you know, are you going to be doing one specific job, or are you going to be doing multiple jobs? I think that's pretty key. And yeah, I mean, my day to day, a lot of work. Honestly, right now, my day to day is pretty much doing all soil testing. We have a lot of that here in town, and so I'm going out there, meeting with the engineers, the excavators, pretty much out on the field for most of the day. Come back, and then maybe the next day I'll probably spend a day or two just like going over plans, reviewing plans. And right now that's my day to day, at least for currently, probably for now until the summer. And then once the fall hits the winter, then you start doing like, at least in our town, we do a lot of hazardous material inspection. I know a lot of towns don't do that, but we do that. So I usually try and like schedule out, all right, spring, summer is I'll be outdoors doing soil testing for septics. Fall, winter, I schedule out to do hazard materials work. So that's kind of how I schedule my year.
Awesome. I love the seasonal part of that.
Yeah.
And, you know, I'm just hearing some of the things that y'all are talking about are technical in nature, and some of them are about like sort of the work day, you know, sort of the style of the work. And so I just saw a note to put questions in the chat. We have a few already in the Q&A. So please put any kind of questions that are coming up for you, because there's a lot of good comments coming in from our presenters. So let's go to our next question, which is, what do you like about your job and what frustrates you about your job? And Sam, let's go to you first for this one.
Sure. So I thought I'll just start by saying the job's so interesting. It's a job you're never going to be bored in, just because there's so much coming at you at all times. And I think Kelechi had mentioned earlier, we're really generalists in this job rather than specialists. So we know quite a bit about a lot of things. So, you know, and you can choose to sort of, you know, focus a little bit more energy in what you find most interesting, but I'm sure there would be something for everyone. There's also just a lot of autonomy in this type of position as far as scheduling goes. And I know Felix was just talking about, you know, scheduling sort of how his whole year looks like well in advance. So it's a job that'll really teach you great organizational skills and time management skills. It's really essential for the job. I also really enjoy about the job the educational aspects, whether that's, you know, educating restaurant staff on an inspection, or you're doing sort of a public information campaign to the community you're serving. That's a part I really love about my job. And the final thing I really love is just there's those instances in your job where you can really see that what you did made a positive impact on someone's life. We really do work directly with a lot of community members, and things we're doing, you know, could drastically improve their life. So it can be really rewarding. And just two brief things that you know, are a little bit frustrating or were frustrating, and it's something you can overcome. You know, here in local public health, I think a lot of us constantly deal with understaffing issues. It was a big problem during the pandemic that's getting a lot better. But, you know, at times when you're missing maybe 10% of your workforce, that extra work falls on other staff members. So it's just something you really need to get together with your team with and figure out, okay, what needs to be prioritized and how are we going to move forward as a department. And just for the job in particular, the biggest thing I had struggle with at the beginning of being an inspector was how much confrontation you deal with in the job. I wasn't someone who liked confrontation at all. And you quickly develop skills to come over that. Just based on your experience, you become more confident in those difficult conversations, you know, and you could still have empathy for people, but I think you just develop a sense of assertiveness and confidence in what you're saying. And that way, those sorts of conversations can roll off you at the end of the day, you know, rather than adding a little bit more stress. So those are just a few things.
Great. Thanks, Sam. Diana, let's go back to you. Things that you like, things that are frustrating.
The things that I like is that the program that I'm working for will help increase public health capacity in our region. That's what I really like about local public health, because even though it can feel slow sometimes, it does move much faster than the state or federal level, and you actually feel your impact. So going back to when I was a health inspector, even when I was an intern in Brookline, I remember I got sent out because someone had complained about there was like a hole in front of their property. A lot of water was stagnant there, so there was a mosquito issue. I was able to figure out that I had to reach out to the Department of Transportation, get the road fixed, and that maybe took a week or two, but that person was so grateful coming back. And I was just an intern, but I was like, oh wow, like I made a difference in somebody's life, even if it was a minor thing. Like that was something huge for them, and it feels really good to do that. So now that I'm working on this grant, it's a little bit more of a community level, just making sure that all the residents are getting the services that they deserve to get and that they should have access to. I think that's really interesting. The frustrating part about my job, I would just say, is because this is such a new program, figuring out like how to use the funds in an approved way, that's been a little bit interesting. So for example, I had wanted to do like a serve safe food handler. So that's like a food safety training for the restaurant, like restaurants would get. And I was like, oh, can I use the funds to offer this to all the restaurant staff like within our region for them to come, so that we know that they have a base level of food safety training. But something like that wasn't approved because the money is supposed to be going directly into public health, and that's kind of like a third party way of doing it. So that's the only frustrating thing, is trying to, when I come up with ideas and sometimes I get shut down, it's a little frustrating, but we make it work and find something else to do.
Nice. Sounds like you have to put your creativity to good use.
Yes.
Okay, let's go to you, Felix. Things you like, things that are frustrating.
Things I like, I definitely like the impact you see on people, whether it's, you know, like a resident, you help them out with any kind of question, but like even like, you know, you're working with like a food operation is looking to like, you know, establish a brick and mortar, and you kind of help them with the plan review and, you know, just like the whole phase from inspection to when they opening. That's pretty cool. You know, people are happy, and it sounds, it just feels good. Like you feel like you're part of the process. And even like, and for me, in terms of like what I do now, like Title V, like, you know, kind of like seeing like the beginning of a project, like from the first start to the soil testing to the end, you know, and like you kind of get like gratification on that. Like, oh, like, wow, like, you know, like we were like, we got this homeowner the septic system that he needed, so he can either sell his home, or, you know, there was environmental impacts, and maybe there was some like wastewater discharges that are being ground to the groundwater, and we found a process to end that. So that's kind of stuff I like. And then what I don't like, probably it could be a little slow. Yeah, maybe not as slow at the state, but yeah, it can be a little slow. You know, things take time. You got to have patience in this job. Yeah, so that's definitely the bad part. But you know, it's just practicing patience, really, I think. So hopefully you get like a, you know, you get like a value out of that from all the bad stuff too.
Great. And Kalechi.
Yeah, Overall, I'm sorry, not overall. So what I would like, what I enjoy about this job, not to like sound redundant or anything, but I think everyone kind of touched on like the same sentiment that you really have, or you really feel like you're impacting people, on a personal level. A lot of the things we do when it comes to inspections or just kind of filtering calls, responding to emergencies, of like any sort really that may happen, in a given community. A lot of times, or essentially every time, we're kind of on site, dealing with it and kind of working with the problem cradle to grave. Um, so yeah, kind of different from like state and the federal government. I would say at the local level, if you really have a knack for kind of interacting with people, and really, solving problems, kind of yourself and seeking different other avenues to just fix problems, is definitely something for you. To be honest, I think that's kind of what does it for me. You know what I mean? Because you get that gratifying feeling. Um, on kind of just any given task you're involved in. So as far as something that I'd say frustrates me or is kind of a frustrating aspect, um, a lot of us, like, we are essentially local government workers, like we work for local government. So at times, I think it kind of takes one to wrap your head around kind of like the infrastructure of like how a given government body works. Because at times, we kind of do our job in the best interest of the public, whereas certain entities may kind of not have that same type of model. Um, so just depending on certain circumstances, you may kind of come in confliction, in terms of maybe the direction of like a town leader or town management as opposed to, a local health department. But I mean, overall, I would definitely say, at least for me, the pros definitely outweigh the cons in that way. So, yeah.
Great, thank you. I think we'll go with one more question for the group, and then we'll jump into some of the Q&A. So let's shift gears to the job search process, because I know that's what a lot of our attendees are really interested in. So what's one piece of advice that you would give someone who is job searching to find the job that they're interested in? And Sam, let's start with you.
Sure. So I think, and especially if you're not set yet on what sort of job you picture yourself in, I would take as many internships or part-time jobs as you can while you're in school, as possible, to expose yourself to different things. I know in grad school, I worked as a mosquito technician one summer. I interned with the state vet, and I also interned with the Brookline Health Department, which were three very different areas. Originally, when I had applied to the Brookline internship, I was an epi-biostats certificate track sort of person. I really didn't have experience in environmental health, but I fell into that division, rather than epi-biostats. And here I am now just because I found the job. Interesting. So I would just say, be open to any opportunity that comes your way, and don't be afraid to branch out for something that, you're not specifically just studying in school.
Great advice. Diana.
Sam took my advice because that's what I always say to people. Because even like in undergrad, I was doing marine science. I did a study abroad program in Australia that focused on plant science because I was like, oh, I've never been exposed to that before. And it was awesome because I got to go somewhere cool. But it did confirm I did not like plants. So that was a good way to weed it out. But yeah, definitely look through part-time jobs, any internships, because even when you're getting hired, because I have been having to hire some staff and helping Needham with the hiring process, what we always look for is some sort of experience. So that always puts you ahead of other people, or at least when I look at resumes, that gives you that little bit of an edge if I see you do have some sort of experience with local public health already, especially if that's something you're interested in pursuing more. So definitely take on as many of those part-time or internships as you can.
That's a great perspective. As a hiring manager or from a hiring committee, I think that kind of advice is really helpful. Kelechi.
Yeah, like I said, when I was in my last year of undergrad, I was really interested in, working in the local public health field, but I truthfully had no idea on like how to do so, or really, I didn't really have any direction on, what steps to take in that way. Um, so I essentially kind of got into local public health, due to the pandemic, because my contracted position was as part of like the CARES Act package. So that was kind of like my lane. While I was at North Andover, or at least once I was kind of in the space of local public health, I learned of like a bunch of different resources to look for jobs, like Massachusetts Municipal Organization .org, which is essentially just like um, a state website that has openings for a bunch of municipal jobs, even outside of local public health. So if you guys have, friends or stuff like that that are in different sectors looking to work in just local government in general, that's a great resource. Of course, on top of, the public health realm. I know MHOA, Massachusetts Health Officers Association.com. They also have like a bunch of local public health career opportunities. And these sites are, at least from what I see, they're super current, they're updated, weekly, if not daily. So you're definitely bound to find some great opportunities there if this is something you're interested in.
Great. And Felix.
Sometimes maybe hard to find internships or part-times in areas that wherever anyone's living at. So like in my town, we actually we have taken volunteers, people who like just want to come and like kind of help out. And I think even that is like a good step. Like, if you're interested in that, they might not be an opening area in the area you live in, but if you volunteer with your local health department, that's like a really good source just to start that building that partnership, that relationship with your local municipality, or even applying to like even like within the board of health. So like those who are residents of whatever town you live in, who are who take actions for within the health department, that can be also a good opportunity, because sometimes it's really hard to find like internships or like part-time jobs. Sometimes you just kind of have to reach out to them and create that position, and then you'll be surprised. Some towns will even compensate you for it. They might not have it, they might not have posted it, but if you're really interested, you can work something out with them. So I would say, if you don't find those kind of roles, then just go out and see if you can, talk to local organizations, local public health, and see if you can volunteer there. Because I think honestly, like that's a really good route for people who maybe just might want to do like a summer internship, summer volunteer at their local health department in their hometown. I think, you'd be surprised what can come out of that.
It's great advice. There's a lot of opportunities at your local health department that they're not posting. It's not easy to find, but if you ask, there's probably quite a few things.
Yeah, they might not even be asking for it, and they just, but if you come up with that offer, they say, oh yeah, we can actually may need you for a role to do this kind of work, and that can lead to possibly a full-time job.
Exactly. You really never know. I think there's a lot of room for being proactive with all this stuff. So we are going to shift to the Q&A, and we have quite a few questions in our Q&A. And so panelists, I think you can see the Q&A. I'm just going to kind of ask a question, and then whoever has an answer, I think we'll just do it that way. Just jump in and we'll try that. So we have one question. This is from a professor at Westfield State University. The question is, what are some jobs that are appropriate for a Bachelor of Science of Health Science degree? While many students are anticipating that they're going to graduate school in health-related fields, many students are stopping at the end of the Bachelor of Science journey. I'm hoping to gain more knowledge in what is commonly seen as an appropriate healthcare job for a bachelor's level job candidate. Thanks for any information. Jobs that are appropriate for a Bachelor of Science in Health Science. Any thoughts?
Yeah, we're just hopping in. Anybody? Okay, yeah. So I did my undergraduate at UMass Lowell. My degree was a bachelor's in public health with a concentration in health sciences. And I would say that that degree is very applicable, to this field. I don't know if I'm not sure if like other jobs like outside of local public health that maybe that degree would require or kind of like anticipate in that capacity. You know, I sorry, I don't know if like outside of maybe this job, I can't think of like any other specific careers, unless maybe research based or something to that degree.
Yeah, I feel like it's a little hard to say because most of us are health, like we had health inspector roles at some positions, so we can't like give you an exact title. But the public health field is very broad. So like Kelechi said, research is an option. Environmental health it's just huge, right? It's a huge field. So there's a lot of avenues that you can take. As far as in Massachusetts to become a health inspector, some municipalities will accept as like they would just take a high school degree, or there's some that would prefer someone with a graduate degree, typically a master's in public health, but that's not necessarily a requirement for every town. But it could range depending on what the town is looking for.
Great, thanks. Okay, we'll go to the next question. This is from Nicole. As someone who's interested in monitoring and evaluation and infectious diseases, what job titles should I look for?
So I just to jump in quickly, I just think with the pandemic, there was a ton of money coming in, at the state level and to local public health. And a lot of new epidemiologist positions were created. So that's one that would work specifically with, disease assessment for your specific community. I've seen a ton of those jobs posted, within the last year. I'm sure more will get posted. There's just a lot of new jobs being created specifically for that. So I think that would be a good one to look for if you have any interest in epi.
Great, thank you. Our next question is from Julia. What advice would you give a graduating student with an MPH who is looking for a full-time job? I think this is probably the big question.
I think just getting like what his advice before, getting involved with a health department in some sort of capacity. If you're looking for local public health, I think that is a good starting point to create some sort of relationship and keep your eyes open for different positions within, because like I said, from a hiring perspective, if you're looking for a full-time job, it always looks good if you have some previous experience in a related field.
I think my advice would be cast a wide net as possible. Unless you're looking for a very specific thing, apply to anything you're possibly interested in. I think, don't get intimidated by job posting qualifications. Those are typically wish lists. We don't have enough qualified staff in the state to fill all those positions with all those requirements. So put your hat in the ring for everything, nothing to lose. If anything, great experience for interviews. But honestly, even hiring inspectors in the past couple of years has been really tough. So even if people don't have the exact experience we're looking for, we're willing to take someone who is educated, bright, enthusiastic, and willing to learn. So just apply to everything you're interested in.
Absolutely. They are all wish lists. Job descriptions are just wish lists.
Yeah, I would say too that like maybe if you can, some people might not know exactly at all what they're looking for, but if you know maybe you want to do some work that involves field work, then this is a job for you. But if you're looking to like be more like an analysis or like maybe do like policy writing, then maybe state, federal, or people who are writing these regulations. By the way, a lot of them come from local public health. So, but yeah, like maybe like trying to figure out what avenue do you want to do field work, then obviously local public health is a place to go, because you're going to get both that experience of writing regulations, but then that on-site project work.
Great. Okay, let's go to Jacob's question. What kinds of classes are most important to take during an MPH program in order to prepare for a position in local public health, particularly for smaller town positions where you might need to be competent in a very wide variety of topics, which is something that you all spoke to?
So a lot of this job is actually learned on the job, because I did my MPH specifically in environmental health. And I feel like I learned a lot of the base knowledge for like the science portion, or just like understanding about different diseases, bacteria, different like topics. But my actual position as a health inspector was learned while I was being a health inspector. Like, I don't think that's something that's really taught in MPH programs. Like the BU program was very general, which was nice, because you get, like everyone has been saying, you get a nice base of everything, a little taste of everything. So if you're like interested, if like biostats is very interesting to you, you can go into epi. So it all depends on like what your ultimate goal is. But in local public health, as an inspector, a lot will be taught while you're working, or you just learn as you're working.
Yeah. If I could add to, me, I'm actually like an MPH student, like currently myself. And I would say if I can compare, like my MPH coursework to my undergrad coursework, neither of them, I would say, honestly, could fully prepare you for the stuff you face on a day-to-day. Just kind of like Diana said, a lot of the stuff you kind of learn or obtain like working knowledge, as you have to deal with it. So, when a similar problem comes back around, you kind of have that toolbox of how you applied, or, whatever you did to fix that problem. I would say, when I was an undergrad, you definitely learn, or at least in my program, because, I have an undergrad in public health. So you kind of learn about, just the grassroots of public health, and a lot of like the early interventions, as it relates to like wastewater, and just treatment of like potable water sources. But outside of that, there was nothing like super specific, I would say, that kind of equipped me for this job. Since I've been working in this field, I would say probably maybe 70% of it was kind of just attained new knowledge, that a lot of stuff I, didn't really have an idea about, and especially septic and stuff like that. Like if you grew up in the city, like I did, you probably don't have an idea of what a septic system actually is. So, yeah.
Stacey, I don't know if everyone on this program already knows about this, but the Local Public Health Institute, which was a website or a program, I think designed by a collaboration between MHOA and BU, they have some really in-depth trainings on their website, from everything to pretty much any inspection you would conduct, to administration and management sort of courses. to take that, give you a really in-depth look at what we're dealing with in Massachusetts local public health. So if anyone's, interested in really getting a better idea of what these sort of positions entail, I think that's a really great resource.
I think that's a really important one to bring up. And again, it's the Local Public Health Institute. And their online courses, you can get little certificates and documentation that you've taken the class. That is stuff that you can stack into your resume that will make you more competitive when you apply and show that you've really actively pursued some of these specific skill sets. So I think that's a terrific point. And Diana, I think you were,
Oh
were you
yeah,
gonna add
I was
something?
because I was when I have interns or anyone starting out in the department, I make them go through those trainings just to get that baseline knowledge, because you wouldn't typically get that before. So if you do it ahead of you applying to jobs, just so you have a better idea of where you want to fall into, I think it's a great resource.
Absolutely. We have quite a few questions. I know we're not going to get to them all, so I'm going to pick one more from the Q&A, I think, and then we'll do a closeout. So this speaks a little bit to, I think, maybe what Felix was talking about, but how should you go about contacting someone or an organization to ask about positions that might not be posted publicly? Like, how do you uncover these things?
Go to the town websites and you can find phone numbers. Not necessarily, sometimes you can't find the emails, but definitely at least a department number can get you connected to an admin who can connect you to the right person to talk about different positions.
I agree. Go to the town website. Everyone's email should be posted there. So look at the division you're interested in. Email everyone. We already all get 1,000 emails a day. What's one more? Love to see people reaching out. And honestly, just call the main line of any health department. They'll get you the email address of whoever you need to talk to. Don't be afraid to reach out. We love to see it.
Oh, and another thing, I think I saw someone asking about professional organizations. So the Massachusetts Environmental Health Association, Massachusetts Health Officers Association, I know they offer student membership, so you could always join that, and there would be contacts through being a part of those organizations as well. They have job boards, and when you become a member, I believe there's a roster that you can go through and find people to talk to.
Professional associations are very important, to connect with. You'll learn a lot. There's job boards, but there's so many other offerings that they have, and it familiarizes you with the landscape of what's going on. So that's a great point. I think we'll do one more question for everybody, and then if we have a little extra time, maybe you can pick something else that's come up in the Q&A. But I just want to make sure we circle around once more for everybody on one question. So what is the one piece of professional advice that you would give your past self? It could be about becoming more marketable or networking or I don't know what, but if you were to give advice to your past self in the journeys that you guys have talked about, what would you offer? Felix, let's start with you.
Yeah, probably related to what you said about networking and what Diana said about, all those professional associations. Definitely join them and attend the meetings and meet people, that's definitely important because they're your network. So if a job comes up, they're going to contact you. So I think that's really important. It's just kind of building that relationship with other people.
Great advice. Diana, I think you were going to jump in.
I think I would tell myself to stick with practicing R, because I wish I could do more data analysis and visualization for myself, so I don't have to rely on another person in the department to do that. Even though our epidemiologist is amazing and great and she does a really good job, sometimes I wish I had that skill a little bit more developed.
And if I could just follow up, because there was a related question in the chat, do you have any tips for learning data management outside of regular classes? Like what would help? like regarding R, SAS, or other data tools?
My only experience with it is through taking classes, but there are certificates and stuff available online, I believe through like even the Google Institute, you can take a course to learn about data management. I believe they're free. I'm not 100% sure, but there are resources online. And I think it's all about just practicing the skills. So digging for problem sets online, practicing with those.
Great, thanks. Sam, advice for your past self.
Yeah, I think I touched on this earlier, but really I would have told myself, just have the confidence to apply for whatever you're interested in. You never know. Also, Diana, I like your answer a lot because I had some GIS mapping skills I had learned in school and did a whole project with for my ILE and everything. And, you know, it goes quickly. So if you do get a position in local health and that's not really a huge part of your job, you know, take the initiative, ask your bosses to start incorporating it in things so you can hang on to those skills.
Great. And Kelechi.
Yeah, I mean, outside of like a lot of the resources that, you know, we have in the chat, so make sure, you know, you guys take a look at that. I probably would have maybe advised myself to just practice a bit, you know, especially at this moment in time, you know, as a lot of you guys may be approaching graduation, and you're starting to maybe apply for jobs and such like that. You know, just kind of work on building yourself as best as possible. You know, resume building, as we said earlier, you know, just kind of getting out there and kind of soaking up as much experiences as you can. Practicing, you know, just like with interviews or potential interview questions, like literally, because as you kind of go through the motions of interviews, you tend to flow a little better and get a little better. You know, as I started or when I was kind of like looking for a bunch of jobs straight out of school, I didn't necessarily do that. And I was kind of just going into like a lot of these interviews, doing my homework, of course, you know, to some degree, but I was kind of just jumping into it. So I would probably just take, you know, if it's a week or maybe a couple of days and just kind of go over your plan and just have in mind kind of what you want to do.
Oh, can I add to that really quick? Definitely use your career services at your school. I used the BU, like in BU Public Health, they have a career development department, and I went to them. I know they offered resume checks to help you improve on how to format your resume. When I was initially offered my job, and this was after I had already graduated too, I went back to them talking about, you know, salary, how to negotiate salary. They gave me a lot of good tips, and it's a good resource to have, especially since you're already paying to go to school. Use all the resources that you have at school.
Absolutely. Get anything for free that you can. Actually, it's not for free. You already paid for it, so you should definitely use it. So I just, there was a lot of good advice in here, and I just heard personally just so much passion for your work and just an enjoyment of the creativity and the journey that you're all on, and a theme of service and helping people, but also using all your skill sets and constantly learning. So I personally really enjoyed hearing about all your experiences and your advice. So I hope everyone got some tidbits from our panelists today. And I just want to thank everybody for joining. And I know that there is an evaluation that will either go out by email or some way that Tali will send to you. So we really would love it if you would complete the evaluation. It will help us. And we're so glad that you all joined. So have a great evening.